Hello everyone, I'm Jose Castillo, Marketing Manager at JIPA Network, and today I have the privilege of speaking with Dr. Kester Nedd, our CEO and visionary leader in healthcare. Dr. Nedd has dedicated his career to solving one of healthcare's biggest challenges, making quality care accessible for everyone. Today, we'll hear his story, the inspiration behind JIPA, and how it's transforming lives. Dr. Nedd, thank you for joining us.
Thank you.
Every great mission starts with a moment that changes everything. Dr. Nedd, can you take us back to a time when you witnessed a problem in healthcare that made you say, I have to do something about this?
Well, I have many such moments. One that's even more impactful emotionally is the death of my mom. Being a neurologist, having been trained in an area of neuroscience that today offers a lot of promise. My mother suffered from a stroke, and she lives in the Caribbean, where I was born, Grenada. And while working at the University of Miami and Jackson Memorial Health System as a neurologist, I had to travel to Grenada on an air ambulance to pick her up and bring her to the United States to get care. Understanding that my mom, all through my career, has said to me, you have to come back to the Caribbean and make a difference. She used to have a saying, we in the Caribbean live between oh God and thank God. Meaning that by the mercies of God, we are able to get through many of the healthcare challenges despite limitations. So my experience in having to go back to Grenada and seeing her in a state that was frankly emotionally quite draining, because I know that in my own career, I take care of similar patients. And to see that they have the opportunity, those individuals have the opportunity to access a level of service, a level of care that is life-saving. And looking at my mom, having her give me the advice that I should pursue a career to help Caribbean people, I was pretty taken back by the state she was in at the moment when I saw her first. And it was one of the most horrific medical scenes I have experienced because at the moment, she was at a hospital that had very, very limited services compared to the hospitals that I work in, where we're given drugs to reverse stroke, and we have techniques and procedures where we could put a catheter in the brain and remove a clot and have a stroke reversed. And by the time I got to her, she was so far gone that she was near death. At that moment, I had to forget that it was my mom and bring together my medical skills to help save her life. That was one of my most impactful experience, and the fact that over the years she's told not just me but all my brothers that we must come back to the Caribbean when we trained and we're ready to go in terms of providing special services and do something. So JIPA, I have to say, was a concept that came to me after realizing how access to healthcare in developing nations were, and how much impact I could have, not just me, but all of the people that I could bring together in changing a system of care that's just not well developed and with limited quality. So from a medical aha moment, I would say this was part of the impetus for me to start the JIPA Network.
Can you tell us what JIPA is and how it addresses the challenges you saw firsthand?
So JIPA Network stands for Joint Independent Provider Association. One of my first understanding of effective healthcare delivery came from my experience working in the Jackson Memorial Health System and the University of Miami. And to understand, in order to create centers of excellence, you must build a team. People have to work together. We have to consolidate. And I chose a field of neuroscience called neurological rehabilitation that dealt with catastrophic trauma and catastrophic neurological condition. And I learned early that when you could bring resources together in a way that you could consolidate that resource, you create an environment where your care is more effective, more accessible, and actually costs less. The concepts I developed and learned about organizing physicians in networks. The United States, through legislation, came up with some legislative policies that encourage doctors to work together for a common good. And that good is to help patients have better quality healthcare. And by using the resource of others and sharing that resource, we're able to maximize the quality of care, the amount of care that is provided. So JIPA, the intention of forming JIPA was to organize physicians for that purpose. And realizing that the Caribbean needed to have those services in a way that would transform healthcare.
Building something like JIPA isn't easy. Was there ever a time when you thought this might not work? What kept you going?
Well, I will say this. Throughout my life, I've experienced many challenges in trying to get things working, to work. And I've been able over my lifetime to adopt a philosophy. I can only do the best I can. And the results and the success is up to the universe. Failure is sometimes the greatest teacher. And I have failed at certain things, but I've used that failure to help me move ahead. And JIPA it represents the culmination of the positive outcome from many things I've done, and I've either succeeded partially, or in some cases failed at. And because of a desire to stick to things and get things to an end point, I believe that we have been able to get JIPA to where it is today. There were many challenges that we faced in getting this organization together, but here it is now.
JIPA has impacted so many lives. Is there a particular patient or case that stands out to you? One that reminds you why this work matters?
The challenge we see in many of our patients is that the healthcare is not affordable to many of the patients in the developing nations. And because it's not affordable, and in many cases not accessible or available, people are left to die or to suffer the negative effects of their illnesses. And when you're in a position where you could look at what you helped do or did to impact on somebody's lives, either to save their lives or to improve their circumstance, you feel rewarded. Mm-hmm. And I've had many experiences of taking care of patients who might otherwise not be able to achieve a level of improvement. And that's rewarding. So there are many patients that I've dealt with. I can think about during the COVID crisis, when we had a patient from the Bahamas that pretty much everyone gave up on. In fact, it was very difficult finding a bed for him in the United States because all the ICU beds were full. But I got a call from that mom, and she told me about her son and said that all the doctors have given up on him. His lungs have totally collapsed. His oxygen levels are quite low. But whatever it takes, doc, I heard that you might be able to work miracles, help me. We were able to get an air ambulance during the height of COVID into the Bahamas, get this young patient. And I saw that patient walk out of Kendall Regional Hospital. We had to use some of the most advanced medical therapies to support his breathing and his lungs and his heart because all of his organs were in failure. And I remember looking at this young man walk out of the hospital, and I thought to myself, we should never ever give up. JIPA, in his role as an organization of physicians between the Latin America, the United States, and the Caribbean, we have been able to get patients access when they could not, or when others would have given up on them, or when they've had little or no resource to be able to access care.
Looking ahead, how do you see healthcare evolving and where does JIPA fit in that future?
Well, a lot of changes have occurred in the world in the time that I've been in existence. And I've seen the transformation of healthcare into these modern times where we could literally have therapies that could cure diseases. Some of our largest challenges in the world today is that there are a lot of great treatments available but not accessible to the man in the street, all because of either cost or the requirements to develop and import technology and trained physicians and nurses and other professionals to be able to provide such great care. In the developing nations, such as in the Caribbean, where the United States was 20 years ago in terms of accessing healthcare. And developed nations, some of them have quite a bit of dollars, so they're able to drive the development. But there are other small countries or even large countries who don't have the resources of the United States, but have done a tremendous job in developing the health system, like in Colombia, as an example. Almost 98% of the population there have access to healthcare, even though their per capita income is even less than the Caribbean. But because they've been able to, in a unified way, develop healthcare by organizing the doctors, the hospitals, in a manner that services could provide it to people at all levels, I believe that the opportunity for the world is to build these networks and build these organizations where healthcare could be provided in an efficient way. The buying power of an organized group of patients or insurance companies or healthcare providers is tremendous when we come together. The ability to achieve a goal. The hardest part to this is organizing, staying organized, and staying relevant. If we're able to come together and organize ourselves in an efficient way, we can achieve a lot. I believe the next generation of healthcare providers, as a mantra, must be organized and work together. And I think this is perhaps the best lessons I've learned throughout my career about how to impact the world as it relates to healing. Technology certainly is useful, but without the human ingenuity and the ability to work together, we can't achieve the goals. Capital is necessary, but without, again, the human ingenuity and the unity and organization, we can't. We live in a world where we are our brother's keeper. We could be our sister's keeper too, brothers and sisters. If we understand how other people's situations impact ours, our kids, our friends, our relatives, we'll be more sensitive to the needs of others. And a career in healthcare where I would consider success is a career that's focused on improving the lot of a population, not just an individual, a country, a community, a family, of course the individual. But we have to think of it beyond our own situations and also understand what others are experiencing. Because I've seen situations where people travel. They may have great care where they live, but they may travel 100 miles away from where they live or in another country and something happens. And those are the times you realize that you are dependent on another person.
Yes.
So the way of the world in terms of healthcare is for us to build the best healthcare system we can, so that if and when we or families or friends or people we don't know would need that service, they would have access. From a philosophical standpoint, I believe that's the way we will be able to transform, improve, make our healthcare system better.
For those watching, whether they're patients, providers, or partners, what should they trust JIPA? What's your message to them?
Our message to our constituents, I would call that, is that first, we have to think outside of the box and not in our own reality at times, and understand that for us to impact the world of healthcare, we have to understand the whole system. We have to understand the patient, the doctor, the nurse, the person or the entity paying for healthcare, like the insurance companies. We have to understand all entities, all stakeholders in this field, and where those individuals are at any moment in time. At times, because we only have the ability to see our own situations, we aren't able to transform or build. But the moment that you have the ability to understand all the issues that stakeholders experience, you're able to transform and change. And sometimes you have to put your own needs behind and put the needs of others. At the same time, you have to take care of yourself, but clearly you move ahead a lot faster.
Dr. Nedd, thank you for sharing your journey and the heart behind JIPA Network. It's inspiring to see how one vision can change lives. If you want to learn more about how JIPA is making healthcare better, visit our website or follow us on social media. Thank you for watching.